Hi everyone, I'm Dr. Mache Seibel. I've been in Boston, Massachusetts, my own stomping grounds, attending the annual meeting of the American Society for Reproductive Medicine. There was some really interesting information from researchers from around the world that I captured on video, and I want to share it with you now. Okay, so first of all, let me just ask you to introduce yourself. What's your name?
Xiang Lin Tan, Dr. Tan.
And where are you? What is your title?
I'm Professor James. I'm the Dodds Professor of Obstetrics and Gynecology at McGill University, and I'm also the Director of the Montreal Reproductive Center.
I have known Dr. Tan for probably 25 years. He's one of the world's authorities in the area of in vitro fertilization and reproduction, and he has started on a new approach to trying to help women not lose their fertility as they enter menopause. And tell us a little bit about that.
Well, as we know, women do not produce new eggs after they are born. And therefore, as they get older, the number of eggs and the quality of the eggs rapidly decline. And a woman's peak fertility occurs in their mid-20s. As a result of which, as women get older, the chances of her getting pregnant reduces significantly, the risk of miscarriage increases tremendously, and the risk of giving birth to abnormal babies like Down syndrome also increases significantly.
Now, what age does the big change start to happen mostly?
Sometime in the physiologically, I would say in the mid-20s, around 27, 28, but clinically to be relevant, probably in the mid-30s.
So a woman who's 35 might want, if she's not in a position to have her family at that time, may want to consider options for preserving her fertility.
Yes.
Or if she's going through cancer treatment and might lose her fertility.
You're perfectly right, okay? So basically, we developed the idea of fertility preservation primarily to help women who were at risk of premature ovarian failure, either because they're going through chemotherapy or radiotherapy or some form of cytotoxic therapy. Similarly, if women were having other treatments for autoimmune disorders, multiple sclerosis, and a host of other diseases, I think they should ask their doctor whether those medications they are taking will reduce their fertility potential.
So for women who are at risk for losing their fertility potential, through medications, through treatments for malignancy, or through a situation where they simply don't have a current partner and they don't want to lose their fertility option, you have come up with a technique to help them. Tell us about that.
So basically, as we know, freezing sperm has been around now for ages, and freezing embryos has been used now for more than 30 years. But freezing eggs was not very successful until recently. So the traditional way of freezing eggs is by lowering the temperature of the eggs slowly, but then because ice crystals form within the egg cells, 50% of the eggs do not survive freezing. We have developed a method called rapid egg freezing or flash freezing. The medical term is vitrification. And with vitrification, we plunge the eggs that we collect into liquid nitrogen directly, freeze the eggs at minus 196 degrees centigrade, and then this can be stored for years and years.
So what you're doing is giving these women who are not necessarily infertile at this time fertility drugs, and then at the time the eggs are mature or ripe, you're retrieving them as though it were going to be in vitro fertilization.
That is perfectly right. But because these ladies are still fertile and they are generally relatively young, the treatment protocols are quite simple. At the beginning of the treatment cycle, we perform an ultrasound scan to make sure everything is fine. We give them hormone injections, which we teach them how to give it at home themselves by subcutaneous pen injections for roughly 10 days, during which they carry on their normal working life. They come in for 2 or 3 ultrasound scans. When the follicles containing eggs are about 18 millimeters in diameter, we then collect the eggs under a short, deep sedation general anesthesia so that it's painless. The procedure lasts about 15 to 30 minutes. They go home 2 hours later. They can go back to work the next day.
And then you take the eggs that you've gotten, and instead of fertilizing them, you simply freeze them for later thawing when the woman is in a position to find the right partner or have a baby.
That is perfectly right, okay? And using the technique that we have developed for the rapid egg freezing, there have been more than 200 babies born now from around the world, and the percentage of problems in those babies are the same as with women getting pregnant naturally.
So if a woman goes through this, what's the ultimate chance she's going to end up having a baby?
That depends on at what age she freezes her eggs and how many eggs she freezes, right? Because I would always emphasize that freezing eggs is a second best option. The best option would be if they have a baby right now, because technology should never be seen to replace what is done naturally.
Absolutely. But anyway, it's not 100%, but somewhere in the range of what would be the success for in vitro fertilization today. Would that be correct?
That's right. In women who are under 35, for example, if we freeze eggs for them, and when we thaw it out, they have about a 60% chance of getting pregnant each time that we use the eggs. So that if they store, for example, 30 eggs, they'll have over a 90% chance of having a successful pregnancy.
If they do this at age 35 or younger.
That's right. If they do it between 35 to 39, they probably have about 40% chance each time they do it.
And in order to get enough eggs, you suggest that women may have to go through it more than one time.
That's right. And because of this, we offer, for example, in my center, a package of 3 treatments, which are generally advised to be used within 6 months or a year, for a cost of about $14,000.
That's 1/4.
1/4. 14.
And where is your clinic? Say it again.
In Montreal, Canada.
And the name of it again?
The Montreal Reproductive Center.
Great. Anything else you'd like to add?
Well, ultimately, I think every woman in the world should freeze her eggs. And I don't want to sound too evangelical about it, all right? But I honestly believe so. And the reason is that every woman loses her fertility sooner or later. And as we know, unfortunately, in today's age, more than 50% of marriages or couples separate. When that happens, the gentleman in question will start a new family. But the lady, if she tries to start a new family and she's now in her 40s, she has much greater difficulty to conceive a child. So this is almost like preventative medicine, like buying insurance.
Fertility insurance.
That's right. That's right.
Thank you very much.
You're welcome.